Welcome to Own Your Heart Health. I'm Dr. Regina Druz, your holistic cardiologist. This week, we will dive into common heart health concerns, uncovering root causes, and unpacking scientific discoveries and controversies. The information provided does not constitute medical advice. Please contact your healthcare practitioner before making any changes that may impact your health. Hello, everybody. And this is such a great Friday because I'm here with a colleague and a long-term friend and one of the honestly luminaries in the functional medicine world, and that's Dr. Myrto Ashe. Now, Dr. Myrto Ashe is very special because her take on functional medicine and how you can optimize your overall health is all about simplicity. It's all about making simple but actionable steps that are likely to change your health and help you overcome some of the issues that you may be facing and embark on a whole new healthcare trajectory. Welcome, Myrto.
Hi, thank you. Thanks for having me. Looking forward.
Excellent. Awesome. So I ask everybody the same question. And so, of course, I'm going to ask you the same question is, how did you grow up to be a functional medicine doctor?
Yeah, that's always a great question. So, first of all, I was a conventional family doctor working in community health centers. And I worked in Massachusetts and then in California for many years, and then in Colorado, where we moved to. And I got to a point where life was too complicated at home, 3 little kids. Husband had just graduated residency, was starting his own practice. And I thought, why would I let the man start a practice? And I'll, because I've already been a doctor for 20 years. So I did that, but that gives you a lot of time to Google. And one of our kids was really not doing very well with conventional medicine. And so I started trying to figure out, just like the patients, just trying to figure out what else there is out there. And it just so happens that I know Mark Hyman from the past, who has been, a great figure in functional medicine. And one day I was at the library and I found a book that Mark had written, and I literally picked it up because, I wonder what Mark is up to, And one of the tables had a piece of information on what we were struggling with that really I had never heard of. And I thought, well, okay, so wait a minute, let me look this up. So of course we have the internet, right? We didn't used to have that. There was a time when every piece of information you wanted, you'd had to spend half a day in a medical library looking at journals, right? But now it's on your computer. You can search PubMed, the Library of Congress, and you can get a lot of information. So I read Mark's one of his books, The Ultramind Solution, and basically I fact checked every single thing that I read that I wasn't familiar with. I stopped every couple of pages and said, "Nah, I've never heard of this." And okay, there's actually research behind it. And oh no, what is he saying? There's research behind that too. And so I tried it myself. I tried the gluten-free, dairy-free, sugar-free diet and all of the supplements that he recommended, and transformed my health completely. I did it because I thought, once I learn how to do this, I can do this with my kid, just a lot of things. First of all, I had asthma at the time, and I completely got rid of it. I also had a lot of joint pains. I was starting the beginning of, osteoarthritis, and that disappeared. My energy was so much better. In general, my outlook on life and every, it was really, really impressive. And I thought I had quit medicine by that time, but I thought, if I can do this with people, that would be extremely valuable. And also, it would be a lot of fun. So,
what a journey. Let's recap. You became a functional medicine doctor courtesy of Dr. Google and of course Dr. Mark Hyman. And so how long did it take you to experience your own health transformation?
Weeks to months, like a very short time.
Okay.
First of all, I lost about 15 pounds without trying, and got back to my pre-pregnancy weight that I hadn't been at for, I don't know, 5 or 6 years. more like probably at that point 10 years, because pre-pregnancy, after the first pregnancy. No, it was really, really, really impressive. I had no idea that I was gluten sensitive. I had no idea. I had no clue. When I finally, I was sort of doing it sort of, halfway, and I did the first test. The Cyrex back then was the only one we had. I talked to the guy on the phone. It didn't look that bad to me, So I talked to the specialist on the phone, and he says, "Yes, but how much gluten are you eating?" And I said, "I don't know, maybe once a week, couple times a week, pizza with the kids." And he laughed out loud. He said, "This is terrible. This is a horrible result." And I thought, okay, I'll take you seriously. And so I did. I've stayed gluten-free since then. It's quite, I mean, I cheat once in a while, I'm human, but it's, yeah, something that I had no idea I had. So that was a big
Wow.
piece of it. And yeah, and then, in general, now I know all the things that, I had no idea back then.
So let's go back to now that you know all the things that you had no idea back then. Sort of like fill in the gap for me. How do you go from your personal health transformation and embracing some of these concepts that were in the book, gluten-free, dairy-free, cooling off your immune system? And, for our listeners, by the way, there is a tremendous opportunity for heart and brain health that does involve adjusting our gut axis, right? Because there's gut heart and gut brain axis. And a lot of that immune system activation that happens in the gut, without a doubt, influences heart health, brain health, and a lot of other issues, as Myrto is describing, your sensitivity to allergens, asthma, osteoarthritis, and whatnot. So, sort of take us through the journey. Is that how did you go from experimenting on yourself and getting a good result to really putting it together in the path that works for your patients? Like, tell us the evolution of this.
Right. I mean, that takes really a fairly long time, in spite of 20 years of being able to deal with patients. So first, I took the first year as 2011. 2010 is really when I started my own transformation. 2011, I went to I took five different functional medicine modules. I went first to the annual conference, and then I also did hormones, immune system, GI, detox, and the AFMCP, which is a 5-day introduction. So it was a really, really immersion. I was doing a lot more
Hmm.
study practicing because, of course, I didn't have a ton of functional. How could I have a ton of functional medicine patients? Midway through that year, I went back to the community health center because I needed to have some income. And there I had the opportunity, really thanks to Medi-Cal, which is Medicaid, to order labs on people learning on them without costing them, you know,
Hmm.
because otherwise you're asking people to pay for your own education. And in this case, I was asking, I suppose, the government to pay for my education. And of course, serving the people of what I was learning. So if I learned, I went to a module and I learned that homocysteine is an important metric that really tells you a little bit about B vitamin sufficiency. I got a chance to order homocysteine on everyone and see,
Hmm.
is this a thing? Like how high are people? Like, I have no idea. I've never ordered homocysteines. And, does it drop when you give B vitamins? Like, is any of this true? Or are they
So
making it
what
up?
did you find? What did you find?
Yeah,
Because I've gone through something similar in some settings, and
yeah.
some of those homocysteines were sky high. So I'm assuming that in your community center you may have seen some pretty sort of high numbers.
Yeah, no, well, it wasn't too bad. It was usually in the teens, and but functional medicine says that's too high. But yeah, they drop when you give people B vitamins, and so you really do get the sense that it is a metric of of sort of a problem that is fairly common, which is some combination of people aren't getting enough, or people genetically need more than is possible to really get in the diet. Um, but the sort of amazing than that was to finally be able to make headway with patients who had previously been really frustrating because they were stuck on so many medications. So even as a conventional doctor, I would look at the list and be, oh my God, I would love to get rid of the proton pump inhibitor, right? But I can't because they're also on ibuprofen. And I would love to get rid of this, but I can't because they're on that, you know. And so I finally had some tools for that. I could say, why don't you try a gluten-free diet? Now we don't need the ibuprofen, so now we don't need the proton pump inhibitor. You're off of two, and of course, as luck would have it, you probably also, some people then also didn't need their antidepressant, and they also didn't need their blood pressure, There was one guy, it was kind of pretty funny. He needed to be on a third blood pressure medication. His blood, the first two rolling. And I said, try two things for me and come back in a month and we'll see. Number one, every meal should have a cup of produce. I don't care what it is, just fruit, vegetables, whatever. And, a couple of times a week, consider a can of sardines. Oh, and he said, sardines. I love sardines. Yeah. Anyway, that was and came back a month later, and not only did he not need a third antihypertensive, but actually we had to get rid of one of the other two that he was on.
Very nice.
I'm like, what did you do? What did you do? Advice, and he shows me how he's lost weight somehow doing this.
Okay.
It was really, really impressive, the level to which, the basic functional medicine advice transformed, some of it being really cheap and simple, transformed the life of people who don't have tremendous amount of sophistication or money or time or, bandwidth or whatever. I mean, they're dealing with some very, very difficult, complicated lives, tons of stress. But they're, first of all, extremely willing, even though they're paying no money, to try these things. And their life, their health becomes transformed. I almost wish for those days, because now I have, some really sophisticated patients.
More difficult patients.
Exercise more than I do. Do all the, meditation that I was going to suggest. And so I have to find more, more complicated. But anyway, it really impressed on me the importance of some of the simple basics.
And so that was your learning ground, right? And I think what's important is that, I think something that I hear in that story, and I'll share a similar story that I had with a patient as well, is that meeting a patient where they are at. Because I remember that I was, when I was a chief of cardiology in a community setting, we dealt with a very sick patient population, was the second largest Medicaid population in the state of New York. There was such a tremendous prevalence of obesity and diabetes and hypertension and high cholesterol, and unfortunately heart failure. And so we were seeing heart failure in very young individuals, so-called non-ischemic cardiomyopathy, where they didn't really have coronary disease, but the burden of risk factors was so severe, inflammation was so severe that essentially their heart muscle would weaken. And I remember one young patient, because he was in his late 30s and he was very overweight, he got admitted with heart failure, was his first admission. And because of his body size, we couldn't finish all of our cardiac testing, because he literally couldn't get into one of our machines for us to do our scans. And so he came as a clinic patient, and him and I, we negotiated that he will do one thing. And one thing is that he would not eat donuts for breakfast. So that was the intervention. No donuts for breakfast. And, it took some time, but this patient successfully lost close to 50 pounds. We finished our workup. And what's most importantly is that he did not have another heart failure exacerbation for over a year. Of course, we put him on all the standard cardiac meds that he would be on anyhow, but we know that even patients on those medications, they don't necessarily go through periods like these where they don't have any admissions. So, meeting patients where they are is really, I think, one of the most critical roles that functional medicine physicians could play. So,
and
you embarked. Go ahead.
Multi-consequence interventions. Losing weight for this patient has so many different benefits that the medications don't necessarily have. And so it's a foundational service, really, that you're doing.
Exactly.
conventional doctors are missing a little bit of the agency, like feel like they really don't know how to make this happen. And in part, maybe, I don't know that they're as convinced of the importance of it. So, this is kind of why I wanted to, why I want us to all remember that we have these things that actually will benefit people across the board, not just their heart, but also their
Right.
their joints or what have you. And
They're everything. Their entire health trajectory, of
yeah,
course.
if we're always focused on, because people love the shiny objects, I still, even in functional medicine, and people are like, oh yes, but exosomes, you're like, yeah, but have diet, are they trying to coordinate their eating with, with some kind of rhythm throughout the day? Do they know how
Hmm.
anxiety when it happens, so that they're not letting their body get attacked by every last, thought and feeling that they have? Because that is going to benefit them much more. It's much stronger and it's cheap and easy.
Than exosomes. That is so true. So you're all about the simple interventions in functional medicine, and you recently wrote a book about it. So tell us about that. What is the book? What's in it? And what are those simple interventions that pretty much anyone can do, right? You said not expensive, not something that people need to invest massive amount of time or money, but obviously they need to be consistent. So what's in it? What are those simple interventions? What's in your book? And what's the name of your book, of course?
So my idea was to find out what had some research behind it, so that I'm
Okay.
recommending things that people take. Yes, it's still, you're going to need a little bit of time and energy to implement, to not like be wasting your time. So if you're some energy putting this into action, at least there's some data behind it. Most likely it will help you. So my book is called The Simple Science. Here it is, The Simple Science of Wellness.
The simple science of, lift it one more time, please. The simple science of wellness, right? And we'll have a link to Dr. Ashe's book in the show notes so that everyone who is listening can get her book. Okay, so The Simple Science of Wellness.
Barnes and Noble, so it's not at Amazon. It's at Barnes and Noble,
Okay.
either in hard paper or ebook also. In fact, the ebook has a chapter that you can read, which is a little trick that otherwise people don't know. It's so it's the chapter that has a lot of really inexpensive, simple interventions. So the first chapter has sort of the cost negative interventions, things like fasting that will actually cost you less than not. You're actually saving money. And then it goes on to cost free and learning free interventions, things like getting out in the sun in the morning to help you set your rhythm for falling asleep at night. So this is free, and it also doesn't require any skill. Something,
Interesting.
yeah, something like the fasting mimicking diet requires some skill. You need to think about what are you going to eat, and how it could require some money if you're going to buy the Prolon kit, but it could also just simply require some skill to figure out how to do the.
So let's break it down a little bit more because I really love this positioning, right? You said some interventions are cost negative, some are cost neutral, and some are more of a cost positive. So what are the top three cost negative interventions, and how did you, what's the reason that you would say that those are top three cost negative interventions?
So there's one really. It's
Okay.
the one that I really like the best is the fasting mimicking diet. That is a 5-day, very low calorie diet. And so, because it's very low calorie and you can do it yourself, you would be eating less than your usual. And so, there's
Okay.
negative in that sense. But it requires some learning and some thought. And it also can be done by paying. I had one patient who told me, like, you can't do it because she can't afford the Prolon kit. It's like, I don't, first of all, don't do it that way. Just eat less than you normally eat. Of course, you can afford that. You would have eaten that day anyways. Some people could say that a water only fast is even cheaper, which is true, but I don't think it's as beneficial. And I haven't seen as much research maybe about the benefits of water only fasting, because
Mm-hmm.
Mimicking is someone's baby, Valter Longo's baby, that he invented it. He's done a tremendous amount of research on it, and we know that it improves metabolic markers, that it improves autoimmune markers. They're working on also whether it might improve some other things.
Hi, everyone. It's Dr. Regina here. I know there are contradictory opinions about nutrition for heart health and longevity. And discussion often gets heated and confusing. There are those who push for low fat, low cholesterol, and then there are fans of a ketogenic diet. There are many anti-meat voices as well, suggesting vegan or vegetarian style of eating. With all the chatter out there on what and how to eat, my team and I decided to create a tool for patients, medical professionals to clear the clutter. It is called Holistic Heart University, and it provides on-demand courses, nutrition and lifestyle resources, information on supplements to make it easier to understand how to make healthy choices for your heart. I'm especially proud of our open office hours for program patients and the Q&A feature where you get to ask your individual questions and put us in the hot seat. Head out to the show notes for the link and use my special promo code to get a huge 20% off on our annual health and wellness subscription. The code is owner20, and I'll see you in the office hours.
Yeah. So let's sort of put it in perspective. So I agree with you that, the water only fasting actually does not have the health benefits that people thought it would and potentially could be detrimental. What about things like intermittent fasting when people, for example, go 12 hours, 14 hours, 16 hours without food? My recollection of Valter Longo's work is that while these are useful techniques, they do have health benefits. There was definitely greater support research-wise for fasting mimicking diet, which is a different type of a fasting protocol. So would you suggest that somebody just tries, let's say, 12-hour fast or 14-hour fast if they're not quite ready to jump into the fasting mimicking diet approach? And let's also talk about what fasting mimicking diet approach actually is.
Yes. So that's absolutely. So the second chapter on cost neutral includes some of the intermittent fasting, which you could also call sort of time restricted eating, which is probably a better about it.
Better term.
Of the data around the different amount of timing, and also so how many hours you eat versus fast, and also when in the day you eat versus fast. So those two things are important and interesting. There's a fair amount of research on, for example, alternate day fasting, where you don't actually completely fast on alternate days. You eat maybe 300 calories and then you eat maybe more than usual or your usual on alternate days. And so there's some good data on that, maybe improving insulin resistance the most. It's a lot more work. You're doing this for the rest of your life, or for the study, you're doing it for 6 months or a year. I'm personally much rather do 5 days and then go back to some kind of reasonable eating, and then a month later or whenever sort of I have bandwidth again, do it again. And so I found fasting mimicking to be more actionable in my life, but other people might disagree and prefer to do something different. So we have alternate day fasting, and we have just simply maybe 11 hours of eating and 13 hours of fasting. It's a fairly safe amount of time restriction that wouldn't cause muscle loss. If you move it to early in the day, and if you move it to early in the day, also benefits metabolic health, insulin resistance, and so on, more than late in the day. In fact, I'm suspicious that the study that showed muscle loss is because they were eating 12 to 8 and 8 p.m. And I think that disturbs sleep. But that's just my guess based on sort of trying to figure out why did the people eating 12 to 8 lose muscle mass. So when people say weight loss, it's always kind of interesting. What weight exactly did they lose? We have to really look at the fine print.
That is so true. And, and I completely agree with you. One of the sort of rule of thumbs that I use in my practice is that if a patient is new to fasting or not new to fasting, and sometimes they feel like they want to go 14 hours or 16 hours, but we're not see the benefit based on the laboratory data, right? So they're actually over fasting, right? So there is this concept of over fasting. And I try to bring them back to a 12-hour interval. And as you said, it's not just the interval itself, but the time bracketing of it, the time restriction, because physiologically, we're supposed to eat breakfast, right? Break fast, that happens with sunlight, with dawn, and, during the daytime. So by the time you reach 12 noon, in whatever time zone you are, you have already been breaking down your muscle for nutrition because you've been active most likely for at least 3 hours, if not more. So I also find that, this time restricted window works best when it's earlier in the day and actually allows you to eat during the time when you're active. And you stop eating fairly early in the evening, and that allows you to settle for the night and prepare appropriately and obviously change hormonally for more effective sleep, there is a lot of good information on it. So the fasting mimicking diet, I love fasting mimicking diet. I use it quite a bit with my patients. Big fan of Dr. Longo's work. He actually just wrote his recent book is called Fasting Cancer, which is a fascinating read. But his one of his initial books was Longevity Diet. So tell us about first of all, what is a fasting mimicking diet and what's your preferred way of using it with your patients?
Yeah, fasting mimicking diet is a recurrent 5-day episodes where you would eat vegan, very low protein, and very low calorie. And
Mhm.
there's also some percentages that they studied, and they feel that these are the best percentages to get their impacts. And these percentages are about 9% protein, which 9% of very low calorie is very little protein. And
Mhm.
about half and half for the other two, fat and carb. And
Fats and carbs. Mhm.
yeah, the first day has more calories, something like 1100, and then the days 2 through 5, in some cases 2 through 7, would have about 750 calories. The research
Mhm.
had this adapted for different weights, right? But actually, the practice, and for us providers, we end up keeping the same calories for everyone. And you can do it using a kit from a company called the Prolon kit from the El Nutra company. And in that kit,
Mhm.
powder soups that you can rehydrate, and you know what to eat because there's box 1, box 2.
They actually changed them to pre-mixed soups now. The new version now has the soups pre-mixed.
Yeah, okay. But anyway, I don't know that they have both. I have never done a kit. So the reason why is because
Okay.
I can't tolerate rice. Rice gives me joint pain. It's one of my problems.
Mm.
Be a little worse than gluten, actually. And so most soups have a little rice powder in there to thicken them, and I haven't been able to do any of the kits because of that. And so I
Mhm. Mhm.
own diet where I just put it on chronometer, and in the morning I have my usual breakfast, to be honest, because it's only a couple hundred calories with my nut milk and my almond tortilla. And the only difference is that I'm not going to put any cheese in there because it's vegan. I have to be vegan for FMD. Um,
So basically, you're doing your own version,
yeah,
right, of the fasting mimicking diet.
yeah. You can't call it fasting mimicking because that's a copyrighted term, but we call it modified.
Right.
Yeah. And so
Modified fasting. Mm-hmm.
you put together some organic vegetables, basically, and you try to measure them, and you try to be honest, and you try to stick to it. But I'll tell you something. I think this is such a valuable intervention that people should find a way to make it work for them. I had a patient
Mm-hmm.
who was telling me that, yeah, I'm doing well. I've lost 8 pounds so far. She's really trying to lose weight. And this is something you can use to lose weight, like a stair step method. You lose a couple pounds every time you do it, and then you try to maintain.
Mm-hmm.
But I can't sleep, she said, during those days. I'm like, well, why a couple of hundred calories, maybe 100 calories, for those 5 days, maybe closer to bedtime. Let's see if that helps you sleep. Some people, it wakes them up. They're like, oh, the body's like, okay, so maybe we should
They're hungry.
or they're hungry or something. It's so valuable to just make it work for you. The extra couple hundred calories you'll get over the course of those 5 days will not undo all of the benefits of your diet. And I know this because I have cheated and yet I have seen the benefits. Drop in cholesterol, improvement in insulin resistance, drop in visceral fat basically if you keep doing it over time. And for patients, some of them have done it themselves, some of them have used Prolon, but they all get the psoriasis is one of the interesting conditions that
Remits psoriasis and eczema. Yep, I had seen that. So I'm wondering because, the fasting, the 5-day course, whether you're doing it on your own or you're doing it using a commercial kit, typically this technically is considered just 5 days and not a cycle. Dr. Longo makes it a point that this is meant to be a cyclical experience where one does 3, at least, sometimes 4, and in my practice, sometimes we have to do more than that, of those 5-day interventions, right? So it's an interventional diet. It's not something that people will be on long term. So those 5 days are the intervention days, and the remaining days are most likely probably for you is what is similar to what we're using, which is, anti-inflammatory type of a diet, cardiometabolic type of a diet. And so we typically repeat this sequence of 5 days for 3 consecutive months, or at least we try to do it with our patients, sometimes 4 consecutive months. There were occasions, for example, for some very specific conditions like heart failure, where I actually had the sequence for 6 to 9 months, and that, was certainly led to a patient benefit. So what is your take on that? Should someone try to repeat it in this 3-monthly sequence or not?
I tell patients that the research was done using 3 cycles. So,
right,
to be fair to the diet, we should try 3 cycles. And we will then check about 2 or 3 weeks after the last cycle is when we will check again insulin and glucose to try and see, about insulin resistance and also whatever their cholesterol parameters to see if we can improve lipids.
Mm-hmm.
And then, that's and it fits, with an elimination diet.
Right. It is a type of an elimination diet. Absolutely.
In my book, but the elimination diet is a sort of a foundational functional medicine intervention. And I'll do the 2 of them together if people are struggling with whatever, along with also metabolic or autoimmune or cholesterol or weight. So a lot of people end up really on both diets for a short time if they can if they can handle the disruption.
Hi everyone, it's Dr. Regina here. Many of my colleagues and I are noticing patients coming to us with self-ordered blood tests. When this trend started to gain momentum, I thought it would benefit many patients. After all, who doesn't want more access to health testing? However, I see that self-ordered labs often lead to more confusion and frustration for our patients. Patients are coming in with a pile of labs and sadly, they're not better off for it. This is why we at Holistic Card Centers have launched Heartwell Toolkits, a curated collection of blood and genetic markers that one can get at home, focused on heart and brain health, gives you all the data you need to make informed and actionable health decisions. The toolkits can be ordered at our shop on holisticcardcenters.com. You can find the link in the show notes. Use the code TESTING10 to get 10% off and free shipping.
That would create a pretty significant disruption, but it's certainly an interesting approach. So beyond the fasting mimicking diet, what is your second simple intervention that a person can do?
Fasting mimicking is that you're not done then. It's not like it has now turned you into a different machine and you will run forever. You regulate again. And so you will have to choose some kind of frequency, maybe twice a year or something where you may want to repeat these episodes and stay tuned.
Exactly. Exactly. Stay tuned. So and sometimes, we do what's so-called 1 day reset. Again, you can use it using a kit, or you can just do it completely on your own. So 1 day reset is a great opportunity for patients who already kind of are stable and they just want to maintain their level of success. So fasting mimicking diet works. Give me a second simple intervention that you like, and tell me why.
Some of the journaling interventions were really interesting to me, how powerful they were. And those speak to stress and mood. But there are
Mhm.
interesting interventions. One of them was a week's worth of asking yourself every night, what went well today and why? And try to find some why that actually relates to your own skills and your own something that you did right. So you're like starting to see your positive role in your life. And doing
Mhm.
just a week, I think, had a 6 month improvement in people's happiness scores.
Wow. So you would suggest somebody does it for a week, and maybe then does it like 1 day a week, sort of going on forever, or, it's very interesting. So sort of like focused gratitude for a week.
Yeah, it's gratitude to yourself almost, right? Because you're focusing,
Yes.
what did I do to make this go right? A little bit is what did I not, what went well today and why. So you're thinking about what went well. It starts to make you focus that, more on what goes well in your life. And I guess after a while that also fades because the natural sort of brain thing is to focus on what isn't going well because you
Hmm.
going to get sidelined by something bad. But actually, in order to be happy, to be a little bit more balanced in that. So that was impressive to me. How long, like long and how impactful that you could even measure, the impact of doing this for 7 days. And another one is after a 3 day intervention. James Pennebaker is someone who's been doing decades of research on basically it's writing about the worst thing that has ever happened to you. Uh,
Oh.
and he has some guidelines. There's a website, and I have some links. There's the initial impact that they found is that the students who tried that intervention had a reduced number of visits to the university health center. Something happened, and they just got healthier. So for me, that's always fascinating.
Interesting.
Yeah, and now they're showing, it's some immune improvement from
Really?
spending 20 minutes, 3 days. It doesn't have to be 3 days in a row, but you do it 3 times, and you're journaling, you're writing down. Um,
So all these negative thoughts need
neg-
an outlet to come out, right? So you're making negative thoughts come out, and you're making room for more positive thoughts and feelings by showing grace to self, right? So you kind of bring it together.
yeah, or as some people have hypothesized that you are putting images into words, and that when you do that, it somehow takes away the power of them or makes the power of them a little bit more encapsulated, like it doesn't run your life anymore. It's in its little spot.
Hmm.
Moves them maybe
Interesting.
part of your brain to an, I don't know. There's a lot of thoughts around that, but there's a bunch of more research on also this Pennebaker journaling. So this sort of thing, like for me, it's like it's doable. I can do 20 minutes 3 times. When I first read about it, I remember because it was 20 years ago, and it was about rheumatoid arthritis patients, and that they had
Mm.
pain scores. And so I had been recommending this to many people for years, and then I forgot about it. So it was cool to
To
reconnect.
revisit it. Okay, so this is your favorite second intervention, sort of. So the first one was fasting mimicking diet, simple, fairly simple, although may require certainly requires preparation, may require a little bit of out of pocket expense, but at the same time, you're not buying your regular groceries, so it's probably somewhere around cost neutral, or at least leaning in that way. The second one is pretty much free, right? This is sort of just journaling and your thoughts, so the cost of a notebook and a pen, if that's what you want to use. What is your third simple intervention and why?
Third one that I really, really love is called tapping. It's also called emotional freedom technique. So involves a
Hmm.
listening, which you can do on a website, or there's an app. The app is free if you want to do some tapping around anxiety. So tapping is self-administered acupressure. You tap, literally tap, on a number of points that you learn what the sequences of these points and how to do it. And the Tapping Solution app specifically gives you some wording. So you can repeat after them or you can listen to them while you tap. And
Is that the name of the app, Tapping Solution?
Solution on your phone. That's right. You can just download.
Tapping Solution. Okay.
So for free, they have a couple of options. I'm pretty sure anxiety is one of them. If you pay for this app, or this is introduces some cost, it's close to $100 a year, so it's some cost. But then you have a lot more options. There's different meditations, and I recommend those to patients. Sometimes a couple of the meditations are called Instant Boost of Health and Instant Boost. And I can't explain to you why Instant Boost of Health makes me feel good. It feels good for me. But there's some studies around tapping, and interestingly, it's been shown that people do have a faster or more marked decrease in cortisol if they incorporate tapping maybe along with therapy or just tapping on its own. But when you do the tapping, you can see that your anxiety level or your sense of depression or whatever the negative emotion you're trying to get rid of, procrastination. They have some meditation, and they have some around weight loss, interestingly. And you can actually feel from the beginning to the end of the meditation that the strength of those feelings has begun to let go a little bit.
To decrease.
Yeah, and I think that for patients, and there's some around sleep, I'm less convinced of the sleep ones, but there is one called Tap and Breathe that I've used a few times to get me back to sleep. It's literally you tap and you take deep breaths. I mean, once you learn.
So breath work is part of it, because usually we recommend breath work, and then we recommend things like heart math, which of course is heart coherence technique, or some of the vagus nerve stimulation. But it sounds like breath work and tapping together could be a very powerful intervention, at least in some situations.
Or you could do just tapping, or you could just do them together. So the idea behind tapping is that the situation that you're talking about, recapping, recalling, refeeling, gets limbically separated. So it's almost as if the situation was happening to someone else. And so your level of reactivity decreases a lot. So the Tapping Solution, specifically, that approach was started with by Nick Ortner. And him and his family, he has a brother and sister who are now both involved also in the Tapping Solution. And they, first of all, have gone all the way to Rwanda using this technique to help with the genocide of survivors over there. And wow. It happens that they live in the place where there was a school shooting. And so they jumped into action and tried to help the families and the parents at the time. So it's not like it's a way to not let the situation overwhelm you. These are real situations. You do not want to not feel something, but also it's a bit of a soothing. It's a bit of all right, so I'm going to feel, but I'm also going to see if there's something creative or positive or, that can come out of this that I can have access to when I'm not flooded and overwhelmed with the feelings that are happening in a very real situation. You don't want to lie to yourself, right? You don't want to lie to your brain.
Right.
So this isn't about that. It's really more about this still happened, but let me see if I can have a reaction that's not a flooded or an overwhelmed reaction to the situation.
Right. So processing your feelings. It's interesting that you're bringing it up because, as functional medicine physicians, we operate, or at least are familiar with functional medicine matrix. And right at the core of that matrix, right at the center, is mental, emotional, spiritual, right? That's MES. And it's literally is at the center. And while there is a whole lot of other stuff stuff built around it, all these nodes that, we typically look at, and we kind of align the patient's story in a very specific sequence called ATM and focus on modifiable lifestyle factors, which is what a lot of them already discussed here. A lot of the kind of arrows or intersections are going into that MES, in that core, in that center. And I think the more I do this and the more I work in this area, the more I come to the conclusion that there is no real success if one does not address this mental, emotional, spiritual center. I had, for example, one of the common areas where we see this all the time, and you probably see this as well, is actually hypertension. There's some studies right now in the cardiac literature that are pointing to hypercortisolism, so high cortisol levels. And typically, in conventional medicine, they get discussed as part of a syndrome, sort of a very excessive cortisol production, and how that is related to high blood pressure. But I can tell you that one does not need to have a syndrome. It's just these chronically elevated levels of cortisol, chronic stress, which unfortunately so many people are experiencing in their life, is enough to keep people hypertensive. And we see this all the time. This is really, an opportunity to bring some of those simple solutions and yet impact conditions that are so powerful. We could make a person lower blood pressure in the office with breath work, right? So obviously this is kind of extending it beyond breath work into a sustainable type of a practice. So Myrto, so your top three are fasting, mimicking diet, journaling, which has a couple of its own techniques behind it, not just one, but kind of two related techniques, and tapping technique that helps individuals to sort of reprogram how they see and process negative experiences or bad experiences. Is there anything else that you would recommend other than those three?
So then, some of them then start to incur a small cost, and some of them still don't require a lot of learning. The one that impressed me when I was writing the book, that is not low cost, but the one that impressed me because I didn't know the benefits were so high, is air filtering.
Mm.
So I was surprised. I mean, yes, I have air filters because I live in California, and we have had fires recently, and so we've had
Sure.
a little bit on air quality, indoor air quality. The house equilibrates with the outside, contrary to, I don't know what they're saying. But when we had the last fire, we got public health recommendations that if people had no choice, that they could go to the library. And I remember calling the library and saying, "Do you guys have air filters?" They're like, "No."
So-
Like, I don't get it. So, like, and meanwhile, I mean, I had an air quality monitor, so I know that they work. And unfortunately, they're expensive because you have to keep changing the filters. But the cheapest version of a great air filter is to buy a 4x4, 2x2 foot, 2x2 foot, what's it called? A box fan, a square box, and to tape to the back of that with duct tape a MERV filter that's the same size as the box fan, a MERV 13 filter. And that's the cheapest filter you can have, and after a while you'll have to change that MERV for 13. In fact, you should probably buy two because then you can compare the color and see how much you're filtering out of your
So what particles does it filter out? Is there a specific sort of range of particles?
PM 2.5, which is particles that are smaller than 2.5, bigger than 2.5 microns.
I see. And
air filters that will go all the way down to 0.003. It's just you're going to have to spend. For example, the Air Doctor and IQ Air they go down to 0.003 microns, so very, very small particles. But but some of the data we have is not, I don't know if it's on the MERV-13, but the air quality people are telling us the MERV-13 is equivalent to some of the filters that you can buy out there. And the studies on air filters show improved sleep and cognition, improved, of course, allergies, improved lung health, kidney health. I mean, it's just nuts. I had no idea. Even
And all of this is in your book. You provided all this information in your book.
all that is in there. Blood pressure even lowers. This is a study of students in Beijing. Improvement in blood pressure after they put an air filter in their house. Even people with smokers in the house have improved.
Wow.
They have a filter in there in addition to the smoker. So
would these filters, because a lot of we hear a lot, and there's a lot of evidence coming out about negative impacts of microplastics, and microplastics being found, for example, in carotid artery lesions that were excised at surgery. And I was surprised to learn that microplastics are actually aerosolized. They're in the atmosphere, and they could be inhaled. So would those air filters like MERV-13 actually filter microplastics? Do we have any information on that?
That's a great question. I do not know. The 0.003 would filter some of the microplastics for sure. But yeah, we should do what is the size of aerosolized microplastic particles. That I don't know the answer to that. And yeah, the indoor air has this big problem that we have all of these items inside. In fact, some of the microplastics are coming from people's carpets. People have plastic.
Right.
And then they breathe for sure, you would breathe all of that. And then there's, the rest of your furniture. Sure. So yeah, it'd be interesting to look it up. I don't know the answer to that. And it could be related.
So lots of interesting things, so I love these simple hacks, they really sort of like address some of the very significant problems where once you go through the simple hacks and I think dial those into your routine. And I'm speaking from a patient perspective, you're likely to see an improvement in some of the things that potentially may have eluded improvement for a number of years. Any closing words or messages to our audience, Dr. Ashe? What would you like them to know? What would you like them to do?
That they're just this understanding that yes, you can improve things. If you want to, you have to find a little bandwidth, but yes, you can. In fact, I think interestingly, something like tapping, the hope with that is like maybe a gateway practice, because the hope to actually give you some creativity, a bandwidth and creativity to actually be able to introduce some of the other practices. I mean, I talk about exercise, clearly, of course, like, yeah, that's free. You can walk. I talk about, sleep and, some really ways to focus on improving that. I have to read it up myself. There's 60 practices in there, so I have to keep looking.
So the author keeps on referring to her own manuscript.
Yeah. The tapping people were giving the example of, okay, so suppose you have a problem, let's say a business problem, your business, some problem that you're having. And on the other hand, right now, a tiger is chasing you, and so you're running as fast as you can. Up alongside and says, quick, give me 3 ideas on fixing your practice or fixing your business. This is not the moment.
That's too funny.
Once you're stressed is not the moment.
And so let's leave it here, is that for our listeners, simple hacks that you can use to optimize your health. We're going to have a link to Dr. Myrto Ashe's book in the show notes. Like she said, there are 60 of those wonderful techniques. We just had the time to highlight her top 3, her faves, and put it to good use, and let us know when you read her book what your thoughts are. We're always looking for the comments and suggestions. And Dr. Ashe, thank you for being a guest on this show.
Hi to all professionals listening to us today. If you're thinking of launching a cardiometabolic or integrative cardiology program in your practice, we can help. At the Holistic Card Centers, we help docs in practice to expand into hybrid or concierge services. Head out to the show notes and click on the application link. Your intro call is entirely free. Ready to schedule a practice review? Use code DOC10 for 10% off our Practice Power Hour 16 minutes coaching session. The link is in the show notes. Thank you for tuning in to Own Your Heart Health with Dr. Regina Druz. This podcast is powered by Holistic Heart Centers. If you enjoyed the show, please rate and review us on your favorite podcast platform. To learn more about our services, visit holisticheartcenters.com and subscribe to our YouTube channel. The link is in the show notes. See you next week.